today's topic would be gout and rheumatoid arthritis. Anybody knows what is gout? What do you mean by gout? Anybody? Anybody knows what you mean by gout? Huh? Be louder. Inflammation of what? Skeletal system you would have come across. Huh? No idea. Anybody knows what you mean by an autoimmune disorder? Huh? Be louder. An autoimmune. What do you mean by an autoimmune disorder? Whenever our own antibody will attack our own antigen, it is considered as an autoimmune disorder. See, basically what should happen whenever there is a foreign particle or a foreign agent, that is when our body's antibody has to react and kill that foreign agent. But an autoimmune disorder is one in which our own body's antigen is killed by our own body's antibody. So, do not you think it is quite a serious condition, because our antigen sources are getting depleted in this kind of a disorder. Can you name some disorders? Autoimmune disorder, anybody? There is something called as myasthenia gravis. Amitabh Bachchan, the very famous actor, he is suffering from this. In muscular system you would have come across this, no? Myasthenia gravis. Muscular system is not yet done. Okay. Myasthenia gravis is also another type of autoimmune disorder, okay, wherein the body's own antigen is attacked by the body's own antibody. This Mr. Amitabh Bachchan is suffering from this disease, wherein all the muscles, they cease to function. Okay. Then there is something known as SLE, systemic lupus erythematosus. It is a skin condition which is also an autoimmune disorder. Example. And another one we have, that is our rheumatoid arthritis. Rheumatoid arthritis is also known as rheumatoid disease. Rheumatoid arthritis is also known as rheumatoid disease because it almost affects all the organs of our body. Okay. So, rheumatoid arthritis or the rheumatoid disease mean the same. Okay. So, we would be looking into some of the symptoms of this disease and what kind of treatment do we opt for such a condition. Okay. First, let us see something about gout. Gouty arthritis is a painful condition that results from crystals of uric acid depositing in the joint tissue. Joint is the junction between two bones, right. So, at the junction you find the deposition of uric acid crystals. These uric acid crystals are called as tophus or tophi. These are the crystals of uric acid which get deposited in the joints, okay, in the condition of gout. It is an extremely painful condition. Just imagine there is a small hairline crack only, it's so painful. Imagine the deposition of such kind of crystals, okay, and obesity, weight gain, alcohol intake, high blood pressure, abnormal kidney function and certain drugs also will promote the development of gout. So, these are the various reasons that could lead to the gouty condition. Okay. So, anybody who is put on a lot of weight, anybody who drinks a lot, who smokes a lot, who has a high blood pressure, whose kidneys are impaired, okay, and certain drugs also might lead to gout. Okay. They lead to the increase in uric acid crystals in the blood, which eventually go and get deposited in the joints, that is in between the two bones. Okay. Gouty arthritis is characterized by a rapid onset of pain in the affected joint, followed by warmth, swelling, reddish discoloration and marked tenderness. It is almost similar to an arthritis. Okay? There is going to be reddish discoloration and excessive swelling and excessive pain. It is highly tender. It is an extremely painful condition. And also there is a certain class of food called as the purine rich food. Purine rich food. Anybody has an idea? Do you know some of the purine rich food? Please make a note of all this. Okay? Write down a list of purine rich food. Okay? People who consume a lot of purine rich food are also more prone to gouty attacks. Okay? Gout is a condition characterized by the deposition of uric acid crystals in the joints, an extremely painful condition. There is warmth, tenderness, swelling, reddish coloration in the affected area. Okay, what are the various conditions or habits which could lead to gout? Obesity, weight gain, smoking, alcohol, abnormal kidney function, and then high BP, and also certain drugs. Okay, and also our purine rich food. Okay, fine. See this, an elderly man suffers from acute gouty arthritis on his big toe. Can you see this? That's a characteristic of a gout. So now as soon as they see this, they will not immediately say yes, this is a gout. You need to confirm your diagnosis, right? So what they do, it is an in-office procedure only. They will insert a needle into that particular area, they will draw the fluid and then they will check whether it is the uric acid crystals. Okay, and then they will confirm it as gout. And that procedure is called as arthrocentesis. Arthrocentesis. Okay, it is in the clinics also it can be done, wherein they will remove the fluid through a syringe and then they will test for the presence of uric acid crystals and thereby they will confirm it for gout. See here, severe gout in the fingers result in large hard deposits of crystals of uric acid. These deposits are called as tophi. Okay, the uric acid crystals, they are known as tophi. Using a sterile syringe and needle, fluid is withdrawn from the inflamed joint and analyzed for uric acid crystals. What procedure is used to diagnose gouty arthritis? Gout is considered when a patient reports a history of repeated attacks of painful arthritis, especially at the base of the toes. Ankles and knees are the next commonly involved joints in gout. The most reliable test for gout is detecting uric acid crystals in the joint fluid, which is obtained by joint aspiration, arthrocentesis, which I have already mentioned to you. Arthrocentesis is a common office procedure. It could be done in clinics as well. Okay. So as to confirm the presence of uric acid, these people will draw the fluid. Can you see? Prevention of gout includes mainly maintaining adequate fluid intake. You need to consume a lot of fluid, okay, and reducing alcohol consumption. Even smoking also a person has to reduce. So reducing alcohol, reducing smoking plus excessive water intake. See, any disorder as such, even kidney stones also could be prevented by consuming a lot of water, because water helps in washing away the toxins from our body. Okay. How are gout attacks prevented? Maintaining adequate fluid intake helps prevent gout attacks. Adequate fluid intake also decreases the risk of kidney stone formation in patients with gout. Alcohol is known to have diuretic effects that can contribute to dehydration and precipitate acute gout attacks. In the sense, this alcohol which is there, when I say diuretic effect, what is the effect of diuretics? They basically help in removing excess water from our body, right? So what in a patient who already has a gout, if he consumes a lot of alcohol, alcohol has a diuretic effect. So it tends to dehydrate the body. The patient loses a lot of water and hence becomes dehydrated. Okay. Alcohol is known to have diuretic effects that can contribute to dehydration and precipitate acute gout attacks. Alcohol can also affect uric acid metabolism and cause hyperuricemia. So, alcohol is doing two things. One is it will cause dehydration by the diuretic effects. Another thing is hyperuricemia. What is hyperuricemia? Increased levels of uric acid in blood. So, there are chances this alcohol might also increase the levels of uric acid in blood. So, already there is a uric acid crystals. So, any more further increase in uric acid crystals in blood would again precipitate, in the sense it will make it even more severe. Okay. It also it causes gout by impeding or slowing down the excretion of uric acid from the body. Yeah. Additional prevention methods include weight reduction and diet change. Okay. We need to avoid purine rich food. Okay. Then dairy product consumption also, some of the products we need to. Then a lot of exercise is required. Exercise, why? Because obesity leads to gout. So, just try to understand what leads to gout and how it could be prevented is by avoiding all those things. Okay. Is it clear? Gout, is it clear? Yes. Gout is characterized by what? Deposition of uric acid crystals in the joints. And what are these crystals called as? Tophi or the tophus. Okay. Fine. Medical treatment, see now first of all you know that uric acid crystals, it's extremely painful. Okay. See, whenever a person comes with excessive pain, will you go about reducing the uric acid level, or first you will treat the pain? Pain, because you need to relieve the patient of the symptoms first, right, and then we can go into the other cause and then start treating that particular cause, right. So, first pain relievers such as acetaminophen, all your NSAIDs or other potent analgesics are used to manage the pain. So, first you will manage the pain, okay, you will reduce the pain. Then secondly, anti-inflammatory agents such as NSAIDs like colchicine, because gout is characterized by tenderness, inflammation, redness. Yes. So, first we treated the pain, now we are going to treat the inflammation. Okay. And finally, medications are considered for managing the underlying metabolic derangement, in the sense first we give painkillers, then we give anti-inflammatory agents to reduce the inflammation, and finally we will see, okay, what is the metabolic derangement here? Here there is hyperuricemia, there is increased level of uric acid crystal. So, we will try to give treatment which would help us maintain or control the levels of uric acid in blood. Okay, fine. Make a note of this, gout versus pseudo gout, write a note on this. Okay. Very frequently asked question, what do you mean by gout, what do you mean by a pseudo gout? Okay. Make a note of it and write the answer in your books. Fine. Shall we move on to rheumatoid arthritis? You find out, that is what. I will tell you one, cabbage. Okay. There are a list of purine rich food. You just make a list of that. Okay. And differences between gout and pseudo gout, very important, please do not forget. Okay. Yeah. Now, what is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease that causes chronic inflammation of the joints. Autoimmune diseases are illnesses that occur when the body is mistakenly attacked by its own immune system. That is what I told you. So, when our own antigens are attacked by our own antibody, that is what is an autoimmune disorder. So, this is one of the examples. What are the other two examples that I gave you? Myasthenia gravis and yes, systemic lupus erythematosus, SLE, it is a skin condition. Rheumatoid arthritis can also cause inflammation of the tissue around the joints as well as in other organs in the body. Because it can affect multiple organs of the body, rheumatoid arthritis is referred to as a systemic illness and can be sometimes called a rheumatoid disease. Now, do you understand? because it's affecting multiple systems of our body, it's considered as rheumatoid disease. So, rheumatoid arthritis, rheumatoid disease means the same. Fine? Yeah. So, here we see the difference between the normal joint, osteoarthritis and rheumatoid arthritis. Okay? A joint is where the two bones meet, all of you know this, to allow movement of the body parts. Arthritis means inflammation of your joints. The joint inflammation of rheumatoid arthritis causes swelling, pain, stiffness and redness. This is a characteristic of all the arthritis. The inflammation of rheumatoid disease can also occur in tissues around the joints, such as the tendons, ligaments, muscles. So, all these tissues that are surrounding the joint also might get affected in case of rheumatoid arthritis. Okay? In some patients with rheumatoid arthritis, chronic inflammation leads to destruction of the cartilage, bone and ligament, causing deformity of the joints. Damage to the joints can occur early in the disease and progress as the individual ages. Okay? See, normal joint, everything is normal here. In osteoarthritis, you just see there is some problem in the joint area, whereas in rheumatoid arthritis, even the surrounding structures are affected. All the ligaments, tendons, cartilages, muscles, etc., all these things are inflamed. Okay? Fine? What causes? It could be viruses, bacteria, fungi. It could be genetically inherited. Somebody in the family also could have it and could have transferred it to the offsprings. Environmental factors such as stress also might lead to rheumatoid arthritis. Scientists have reported that smoking tobacco also increases the risk of rheumatoid arthritis. So, one has to stop smoking and drinking if they want to stay away from gout and rheumatoid arthritis. Okay? What are the symptoms? Fatigue, extreme tiredness, they do not feel hungry, lack of appetite, low grade fever, always there is a low grade fever, in the sense, you know, it's not increasing also, but that feverish feeling is there. Muscle and joint aches, stiffness, muscle and joint stiffness, usually in the morning. All these arthritis patients, they feel the pain and the stiffness in the morning. Joints frequently become red, swollen, painful and tender. So, all the symptoms of an arthritis is common for all these things. Okay, but additionally, as you all know, that rheumatoid arthritis affects almost all the systems in our body. So, there are extra symptoms as well. Okay, so let us see what they are. Since rheumatoid arthritis is a systemic disease, its inflammation can affect organs and areas of the body other than the joints. Examples of other areas that may be affected include the following: Sjogren's syndrome. Sjogren's syndrome means xerophthalmia and xerostomia. Okay, let me tell you. Here S is silent. Sjogren's syndrome. This is characterized by xerostomia, which means dry mouth, and xerophthalmus, which means dry eyes. So, there is excessive burning sensation. Okay. So, first thing is Sjogren's syndrome, which is characterized by resulting in the inflammation of glands of eyes and mouth, causing dryness of these areas. So, xerostomia as well as xerophthalmus. Then it causes the inflammation of the lining of the lungs. Lungs lining is called as pleura. Any inflammation ends with itis. Okay. Remember, any inflammation, see arthritis, okay, pleuritis, pericarditis. So, any inflammation ends with itis. Okay. First thing we saw Sjogren's syndrome, which is characterized by xerophthalmia and xerostomia. Okay. So, now the next one, pleuritis, that is inflammation of the lining covering the lungs. Next we see pericarditis, that is the covering of the heart is also inflamed. Then we see reduce the number of red blood cells, causing anemia, and it also reduces the reduces the number of both RBC as well as WBC. Decreased WBC can be associated with enlarged spleen and can increase. See, WBC basically helps in acting against infections, right. So, now when there is a reduction in the WBC, then the body is more prone to getting infected. Okay. Then lumps under the skin, rheumatoid nodules can occur around the elbows, fingers, etc., whichever is under pressure. The pressure areas you can see rheumatoid nodules. Then there is one more thing, a very serious complication, that is swelling up of or the inflammation of your blood vessels. Okay, all your arteries, veins and capillaries, there is inflammation of your blood vessels, that is called as vasculitis. Okay, all these are ending with ITIS. So, what all did we see? First we saw Sjogren's syndrome, what is under Sjogren's syndrome? Xerostomia and xerophthalmos. Next we saw what is it? Pleuritis. Yes or no? What is pleuritis? Lining of the lungs. Next, pericarditis. Next, reduction of RBC and WBC. Reduction in WBC makes the body more prone to infection. Spleen is enlarged. Yes? Then what did we see the most severe complication? Vasculitis. What is vasculitis? Inflammation of the blood vessel. Okay, and one more thing we saw was rheumatoid nodules in the pressure areas. Yes? Okay, these are the various symptoms of your rheumatoid arthritis. Let us see if there are any more. Yeah, so that is about the symptoms of rheumatoid arthritis. So, you should be able to say it is an autoimmune disorder. Why is it called an autoimmune disorder? Then why do you call it a disease? Why is it called rheumatoid disease? Okay, and just not rheumatoid arthritis, because it affects almost all the systems of our body, and you know how. What are the symptoms? Okay, Sjogren's syndrome, pleuritis, pericarditis, vasculitis, rheumatoid nodules, anemia, felty spleen, that is enlarged spleen and making the body more prone to infection because reduction in the WBC count. Okay, so now let us look into the treatment. Okay, treatment of, don't get confused between the treatment of gout and rheumatoid arthritis. Okay. Two classes of medications are used in treating rheumatoid arthritis. First is the fast acting first line drugs and the slow acting second line drugs, also referred to as disease modifying anti-rheumatic drugs or DMARDs. Okay, disease modifying anti-rheumatic drugs. The first line drugs such as aspirin, cortisone, these are steroids. First you give them steroids which are used to reduce both pain as well as inflammation. Okay, first we treat them with steroids. Then the slow acting second line drugs such as methotrexate, hydroxychloroquine, they promote disease remission and prevent progressive joint destruction, but these are not anti-inflammatory. Okay, so methotrexate you have come across somewhere else. Where is that? Anti-cancer drug. Yes? Okay. So here what they do, they will not allow the joint to get destructed anymore. So just remember chloroquine and methotrexate, which is a second line drug, slow acting second line drug that is given for rheumatoid arthritis. First line drug is your steroids, aspirin and cortisone, that will help reduce the pain as well as inflammation. There is no special diet for rheumatoid arthritis. Fish oil may have anti-inflammatory beneficial effects. Likewise, benefits of cartilage preparations remain unproven. Okay, oral acetaminophen. So the regular analgesics, painkillers are given, or some topical painkillers also, like you have your Volini and all that, right. So they also have certain topical painkillers, topical preparation which can be rubbed into the skin so as to reduce the pain. Then for Sjogren's syndrome, again they give steroid drops, Restasis, corticosteroid ophthalmic drops. See, basically you concentrate more on the first line and second line treatment, that's more than enough. Okay? First line drugs is your steroids, which is your aspirin and cortisone, which helps to reduce the pain and inflammation. Second line is methotrexate and chloroquine, which prevents the any further joint destruction. Okay? Then for any other respective syndromes, that is for in the eye it is Sjogren's syndrome, eye and mouth, then pleuritis, pericarditis, respective corticosteroids are given. That's it. Okay? Is it fine? All of you? Gout? Any doubts with the gout? Please make a note of what are purine rich food and also learn up the differences between gout and pseudo gout. Okay? And rheumatoid arthritis also, I have repeated it enough number of times, I hope you all remember it. Okay? Shall we? Okay. So this completes your class today. Today your class is over faster. Okay? Yeah. Yes, what is her age? You ask her to get it checked once. Is it like more in the winter? Is it more in the morning? Any seasonal variation? Steroid injections to reduce the pain and inflammation. Okay.